paninindigan, katapatan, kabayanihan. Isang taos-pusong pagpupugay sa mga tumugon, nagtiyaga at nanindigan para sa inang bayan. Good day. We are the researchers from BSN 3B Group 4A. I am Tasic, and together with me are Margreth Joy Sioson, Nicole Soriano, Louise Tambanillo, and Rax Tan, under the guidance of Dr. Sheilla Trajera and Dr. Toni-An Lachica. And our research title is Ang Bayan Kong Sinilangan, Lived Experiences of Filipino Nurses Working in the Philippines. As for the purpose of this study aimed to explore the lived experiences of Filipino nurses working in the Philippines. For the methodology, for the research design, the researchers used a qualitative and phenomenological approach, and an in-depth interview was used to gather the data from the participants. As for the participants, 9 Filipino registered nurses with at least 10 years of field experience in one of 3 nursing disciplines: public health, academe, or clinical, currently employed in the Philippines, participated in the study. This study included 3 nurses from each discipline, 3 nurses working in hospitals, 3 public health nurses, and 3 nurses serving as clinical instructors in universities. A purposive sampling technique was used to choose the study's participants based on the criteria.
Next, we will discuss the instrument. Part 1 was the socio-demographic profile, and Part 2 comprised the overarching question. Can you tell us about your experiences working as a nurse in the Philippines? Part 3 followed, wherein the probing questions were asked. As we move toward our results and discussion, allow us to walk you through each part of this simulacrum to deepen your understanding of the insights revealed in this study. We will start with our first theme, Roots of Belonging, Staying Where the Heart is Planted, under which is our first sub-theme, 1A, Staying for the Love of Family. This sub-theme is summarized by Maria, who stated, "When you truly love someone, it's like there's something holding you back from leaving." The second sub-theme, 1B, Choosing to Stay for the Bond of Friendship. As stated by Tonyo, "That's why my friends have become part of my family." They're the reason, or one of the reasons, behind that question, "Para kanino ka bumabangon?" The third sub-theme, titled 1C, Caring for Others as Family. As stated by Nining, it's like when you give service to someone. For example, when you educate them, you treat them as if they're your own family member.
For our second theme, it is the trunk of dedication, growing resilience through service. Under that is our first sub-theme, honing skills and perspectives through years of service. As stated by Tonyo, you need to be resourceful with the supplies and equipment that are ideally meant for the patient but are not always available. Our second sub-theme, shaping Filipino identity and pride in nursing. As stated by Sirio, a Filipino nurse is known to be the best of the country and the choice of the world. It's all about the passion and the compassion and the care that goes with it. For our third sub-theme, valuing a nurturing workplace environment. As stated by Elena, "Yeah, I am satisfied with my work environment ever since. I will not stay in that institution for that long kung hindi ko satisfied."
Third theme is Leaves of Rejections, Embracing God's Redirections, with the first sub-theme entitled as 3A, Freeing Life Abroad. As stated by Elena 52, if you're in Saudi, you'll get raped. So I was actually really scared. The fear of taking care of foreigners that is very heavy. Second sub-theme is 3B, Encountering Hindrances to Overseas Pursuits. As stated by Raya 53, it's like that. I was afraid because... Anyway, I was afraid. I applied, but I failed, so I was discouraged. And last sub-theme in the third theme is 3C, Trusting God's Greater Plan and Purpose. As stated by Francisco 50, it is up to the Lord's will if you are meant to stay in the Philippines.
The fourth theme is the fruit of purpose, reaping satisfaction beyond compensation. The first sub-theme is finding happiness through contentment. As stated by Divina, I can say at this rate nga I am fortunate than my classmates having millions of pesos now. Why? Because I'm happy with what I'm doing. Second sub-theme is finding purpose by giving back. As stated by Tonyo, I realized nga I really owe something para sa people of Negros. Sa nag-work na ko, dito ko na-realize nga lain ang fulfillment if you are serving your countrymen. And the last sub-theme is finding meaning and validation. As stated by Neneng, actually the patients return to you saying, "Mom, thank you so much because of this or that." That encourages you to continue giving your service.
In conclusion, this study's findings suggest that the rooted relationships these nurses have, their dedication to their work, their belief in God's will, and the satisfaction gained beyond monetary compensation are the defining factors influencing their decision to stay in the Philippines. These four themes would lead us back, which also strengthened the core concept of this study, ang bayan kong sinilangan. These lived experiences show that for them, bayan kong sinilangan is not just a birthplace, but the very soil in which their lifelong commitment and nursing vocation take root and blossom into a profound sense of purpose as Filipino nurses. This is also why we incorporated the colors of the Philippine flag to symbolize and reinforce that strengthened core concept of bayan kong sinilangan.
Let us move on to the recommendations. So this study is recommended to first for the government officials to develop strategies and invest in improving working conditions, staffing, and institutional support to strengthen nurse retention. Second is for the healthcare institutions and nursing schools to continuously enhance curricula and workplace training to reinforce Filipino nursing identity and competence in emerging healthcare practices.
As for Filipino nurses in the Philippines, this study may pursue professional growth, build support networks, and maintain work-life balance to manage workplace stress and burnout. For nursing students, the research may provide them with a broader perspective on their career options, to embrace local opportunities in nursing, and cultivate advocacy for national service in healthcare.
For families, provide emotional support and affirm nurses' choice to stay, promoting balance and community engagement. And lastly, for future researchers, explore nurse retention through field-specific, regional, and longitudinal studies focusing on policy and organizational impacts.
You may just scan this QR code for our references. And thank you so much for listening. Have a great day ahead.